Hello, everyone. Welcome to Lump Basics. We are now on episode 61. This is also called the Lump TCM and Acupuncture for beginners. Today, we shall start by discussing the water element, the urinary bladder. The coupled yang organ is the urinary bladder. The function of the urinary bladder is to hold and to eliminate urine. It should be able to eliminate on cue when it is full and should hold the urine when not full or when a toilet is not available. So let's talk about urinary bladder yin stagnation. We have a full bladder with difficulty starting to pass urine, weak flow, and some amount left in the bladder at the end. There is also increased night urination. Then the next, we have the urinary bladder qi deficiency. There is dribbling or stress incontinence, increased night urination. Thirdly, we have urinary bladder hyperactivity. There is frequent and urgent urination in small quantities, and this could mean cystitis, or may occur when a person is nervous, may have dysuria with blood or pus. And we have the urinary bladder yin and qi deficiency. There is frequent and urgent urination, worse with cold weather or when nervous. There is also dribbling or stress incontinence. Treatment for urinary bladder damp cold stagnation. We use the points bladder 28 and 32, needle and cupping, 10 minutes of each point. These are the back shoe of the bladder and the local point. Cupping promotes emptying of the fluid from internal organs. Then we do Ren-free, moxa, and stomach 29. These are local points. Spleen 6, the area distal point. Then we use the bladder 58, luo point, which sedates the yin and tonifies the yang. Stomach 40, of course, to circulate dampness. Li4, the great eliminator, to help the urinary bladder empty completely. Next, treatment for urinary bladder qi deficiency. Urinary bladder 28, urinary bladder 32. These are back shoe and additional local point for the urinary bladder. Then we do Ren-free moxa, the front mu and local point for urinary bladder. This will tonify the yang with moxa. Then we use the tonification point, bladder 67, and kidney 3, which is an earth point to tonify kidney yang. And of course, we have spleen 6, the area distal point. Hyperactive yang in urinary bladder. This describes the symptoms of damp heat in the urinary bladder. Ren-free, the front mu point of the bladder, cools and calms. We also use spleen 6, the area distal point, and of course, kidney 4, the luo point, with bladder 64 sedation, which is a yuan source point. Tonifies yin and sedates the yang. Bladder 28, bleeding cup, and this will eliminate harmful heat with bleeding. Do 20, tranquilizing point. Bladder 63, she cleft, or bladder 65, sedation point, sedation. Keep sipping water and rest well. After recurrent or prolonged urinary tract infection, the harmful heat of the inflammation may inhibit the healthy functional qi of the urinary bladder. Then it is possible that the urinary bladder does not empty well and there is some amount retained in it. The picture looks like this. So let's look at the tower diagram for harmful heat that inhibits the functional qi, which means that there is inflammation. In this case, the treatment should be to eliminate the heat and to improve the function. So we do bleeding cup on tender points at bladder 28, which is the back shoe of the urinary bladder. Bleeding eliminates the heat without affecting the qi. REN3, the front mu point of the bladder, spleen 6, distal point, bladder 58, luo point, dissidates the yin and tonifies the yang, increasing the efficiency of elimination of urine. Li4, great eliminator, also will help elimination improve. Now, let's talk about urinary bladder yin and yang, or qi deficiency. This is a chronic state with deficiency of both. And since neither can control the other, in yang situations, the yang will dominate, causing frequency and urgency. And in yin situations, the yin will dominate, causing night urination, dribbling, and incontinence. Treatment: REN3 and bladder 28-32. Mild moxa can be used not to make the skin red. Kidney 7 and bladder 67. These are tonification points. These may make the frequency worse at the beginning because of the extra energy that flows in, but this would soon settle down. The initial sessions can be once weekly to avoid this complication, and once the patient is better, treatment could be given twice a week. Many books describe symptoms of cystitis as damp heat in the urinary bladder. This may be due to the fact that there is often a slippery pulse quality on the water urinary bladder pulse position. The urine is colored and turbid, may be with some blood cells and pus, showing that there is stagnation of fluid here. But as long as there is frequent and little quantities of urine each time, with no sign of any remaining urine in the bladder, the picture is of a yin deficiency. Spleen 6, distal point, and Li4 to help elimination. In all cases of urination problems, it is important to avoid caffeinated drinks that irritate the bladder and to keep the lower abdomen and the feet warm with suitable clothes and footwear. The urinary bladder associates directly with the uterus and the prostate gland. These organs lie over each other and are influenced directly by treating the UB meridian. We have all heard about the turning of a breech baby in late pregnancy using the point bladder 67 moxa. Now let's talk about turning a breech baby in late pregnancy. The best time to do this maneuver is between the 28th and 32nd week of pregnancy, week 28 to 32. The 34th week is the latest. It may be true that left without treatment, the baby may turn after this time, but it is perfectly safe for this to happen with our treatment as well. If the baby moves into the head presentation position after 34 weeks, it might be impossible for the head to engage in the pelvis because it is too large. So it is not an effective treatment for working towards a normal childbirth. The mother-to-be ends up with a cesarean section anyway. Treatment. The mother-to-be lies in a semi-reclining position on the bed with clothes loose around the abdomen. The therapist sits at the foot of the patient with a lit-up moxa cigar. Point bladder 67 is used on one foot with sparrow pecking movement of the moxa cigar. The patient should tell you when the heat is uncomfortable. When it is, then the other foot, bladder 67, should be warmed. When that feels too warm, you should go back to the first foot again. Alternate between both feet for 6 to 10 minutes, depending on how soon the patient feels the heat. The treatment should be given daily for 3 to 5 days, and every day beginning the treatment after checking the baby's position. Treatment must stop when head presentation is noted. The mother-to-be will notice increased contractions and baby movements during and after the treatment. This is quite safe. If there are increased contractions of the uterus at any time, either in dysmenorrhea or in pregnancy, this could be calmed by sedating bladder 65, the sedation point. We have already talked about habitual miscarriage and uterine fibroids. Prostate hypertrophy and prostatitis have also been discussed. Remember that each time we tonify the urinary bladder yang, we inadvertently tonify also the kidney yang. And when we sedate urinary bladder yang, the kidney yang is also sedated. Now, there's a question if we can cause contraception through acupuncture. We are wary of causing this energy state permanently, but tonifying, using the tonifying point, bladder 67, on the morning after is a good precaution. So there was one young woman who decided to try this out, and she developed bad kidney colic afterwards and passed 2 small stones. Thank you very much for your attention. Next, we talk about the wood element, the concept. And it is said that those with liver Yin deficiency are looking for a good fight, while those whose yang is deficient would any day walk away from a fight. People with liver Yin excess do not get angry, whereas liver yang excess personalities only know anger. Okay, associated flavor for the wood element is sour. The body always wishes to balance itself. When there is a deficiency, the body tries to bring it to a balance by craving certain foods or by avoiding certain foods when there is an excess. We can understand the imbalance if we can recognize these extreme likes or dislikes in our patients. For instance, when a pregnant woman craves for pickled cucumbers, it means that she has a liver yang or qi deficiency that the body is trying to fill. Sour and bitter sour flavors, such as in pickled foods, lime, lemon, grapefruit, citrus fruits, when they are not ripe, tomato, sour pineapple, and wine increase the liver yang. If the liver yang is high, these foods worsen any symptoms of disease that the patient is suffering from. Skin itching and eczema, wandering type rheumatic pain of the joints, migraine attacks, and even epileptic fits are known to worsen with the consumption of these foods. Such patients should be advised to avoid these foods. In liver Yin deficiency, there is a noticeable craving for sweet sour and cream sour flavors, such as sweet oranges or ripened citrus fruit, sweet tomato, yogurt, and sour cream. If combined with a stomach Yin deficiency state, such people also crave oily foods, such as butter and deep-fried foods, as well as sweet, creamy flavors, which could cause an overweight problem. In liver and gallbladder yang or qi deficiency, there is a dislike of and intolerance to milk, though not necessarily to other milk products. Milk causes nausea, and fatty foods can create distension below the ribs, causing loud and long belching to alleviate the feeling of fullness, and fatty yellow stools follow. When patients have both yin and yang deficiencies of the liver, then they crave all these foods and suffer afterwards. This is because whichever energy is increased, it will cause a relative excess when compared with the side that is deficient. Okay, next we talk about the wood element diseases. Okay, treat the person. We shall today present 3 subgroups of patients who present pains like fibromyalgia. The treatment for the person is given at the same time as that for the type of pain. Initially, it is more important to treat the person with fewer needles for the pain. If the pain does not improve with this, then you could concentrate on it more. Okay, then first we talk about the perimenopausal woman. Okay, as you can see from the tower diagram, the kidney yin decreases in menopause with ascending heat to the upper warmer. Symptoms: hot flushes, night sweating, restless sleep, hair loss, tinnitus, dryness, dizziness, and quickly exhausted. Treatment: of course, we tonify the kidney yin. We use Luo Point Kidney 4, which tonifies the yin and sedates the yang. Ren 3, front midpoint of the urinary bladder, tonifies the yin also in the lower warmer. Spleen 6, distal point of the lower warmer, the meeting point of 3 yin meridians. Bladder 40, the earth point of the urinary bladder, the grandmother point. So this tonifies the yin of the urinary bladder. Water, so drink, use water, cook in water. And always advise a midday rest, avoid coffee, red meat, and exposure to heat. Second, the depressive, exhausted patient. Okay, as you can see from the tower diagram, the heart, lung, blood, and chi are deficient. So there is empty pulse in the upper warmer. Liver blood deficiency. Symptoms: pale, cold, hunched posture, endogenous depression, arms and legs go numb easily, dizziness, weakness, always tired, tearful. Treatment: tonify the upper warmer, tonify the blood. For depression, we use Ren 14 and Bladder 15, the front mu and the back shu of the heart, respectively. And we also use lung 1 and Bladder 13, the front mu and the back shu of the lung, respectively. And pericardium 6, which is the distal point for the thorax. For blood, heart yin and yang tonification, Bladder 17, the influential point for the blood, spleen 10, sea of blood, gallbladder 39, the influential point for the bone marrow. For energy, we use Ren 6, which is called the sea of energy, chi high, bladder 24, back shu point for the sea of energy, chi high shu, and stomach 36. Third, we have the damp edematous type. Symptoms: edema in the eyelids, hands and feet, or edema in the face, arms, and legs. Stiffness and limited mobility on starting to move after rest. Fullness in the middle warmer, semi-solid stools, heaviness in the limbs. Treatment: tonify the spleen function, circulate, and eliminate dampness. So we have here a tower diagram which shows spleen chi deficiency and stagnation of dampness. So we use spleen 9, which is the water point of the spleen. It promotes diuresis. Stomach 40, the luo point, which sedates the yin, tonifies the yang, improves circulation. We use bladder 20, the back shu point of the spleen, to improve the function. Bladder 39, the lower C point of triple warmer, to improve the function. Then we do cupping on the spleen back shu points. Avoid damp-producing foods, refined carbohydrates and sugar, fats and fatty milk products. Eat cooked and warm meals. Drink warm water. Eat light, small meals in the evenings, fuller meals during the day. Up next is the metal element. When treating the nose, always observe the skin in the upper body, especially the face. This gives information about dry, damp situations. and also if there is cold or heat in the lung. So the following table should help you recognize and treat some common symptoms associated with rhinitis. Local, distal, and symptomatic points are added to the points in the table. So so we have here 3 columns: symptom, 1 column for the imbalance, and 1 column for the points. So let's start with black nose in bed and runny nose other times, or black nose alternating with runny nose. So the imbalance is lung qi, stagnation of lung qi deficiency, and stagnation of dampness. So the points, we use bladder 13 and bladder 20. These are the bakshu of the lung and the spleen, respectively. And we use Li4 and 6, low point, wind elimination technique, wind elimination tonification on gallbladder 20. Now, symptom, constant runny nose, so there is lung leakage. So as you can see, both lung qi and the yin are all, there is also yin stagnation. So you have lung 1 and bladder 13, the front mu and back shu, respectively, of the lung. Later, substitute this for lung 9, Li11, and Ren 17. Sneezing in the mornings on getting up. So as you can see from the tower diagram, the lung qi deficiency is decreased. Poor adaptation to environment changes. So we use bladder 13 and Li11. Sneezing or black nose early in the morning at 4 a.m. while still in bed. So we have lung wind symptoms. So here you could see wind heat and wind cold. This is an excess time for the lung, and even though this is a chronic problem, the symptoms appear conditionally at an excess time. So the points: gallbladder 20, wind elimination, tonification, Li6, bladder 66. The treatment should be given to sedate the excess aspect and tonify the deficient. Gallbladder 20, wind elimination, sedation, lung 7, kidney 10, tonification of bladder 66, sedates the lung yin. So we're talking about wind cold on the organ clock. Kidney 10 tonification sedates the large intestine yang on the organ clock. Often, sinusitis with colored mucus may be present with blood. So here you could see qi deficiency with damp, stagnation, and intermittent heat from this. So gallbladder 20, heat elimination technique, bladder 13, Li4, bleed, lung 11. Sneezing only when in contact with pollen or other allergen. Okay, there is wind heat in the lung. Okay, so points, lung 1, the front mu point, and lung 8, gallbladder 20, wind elimination, sedation technique. Okay, bronchial asthma. Have you often wondered why so many people are suffering from asthma in recent times? Patients coming with other problems for acupuncture treatment often forget to mention the fact that they are asthmatic and are on long-term steroid inhalers. No one seems to recognize the seriousness of the disease as long as they can suppress it with inhalers containing steroids or bronchodilators. There is not sufficient awareness among the patients of the adverse effects of bronchodilators on the heart or the side effects of steroids. Bronchial asthma shows that the pathogenic factor has moved to the interior as the exterior wei qi, or protecting energy, has been too weak. The cure would be to strengthen the lung and the wei qi, which is pretty much similar as lung qi is our protecting energy, and we establish the relationship between lung and the other organs of the 5 elements. So we have a simple table covering 2 types of bronchial asthma, which we shall show later. So treatment, the points are pericardium 6, bladder 13, and Dingshuan, the extra points for asthma, located Hapchun beside Du 14. These are used in both types. So we have here a table for lung wind heat type and the lung damp cold type. Okay, let's start with the lung wind heat type. Asthma is intermittent. There can be totally normal periods when the patient does not need any medication and be quite active. The acute phases occur suddenly and can be very serious, lasting a few days. Acute phase may be precipitated by allergy, respiratory infection, or emotional upset, especially anger. Acute attacks with dry bronchospasm and severe dry cough. Thin skin, less body hair. Emotionally labile with extreme manifestations of joy, grief, or anger. They can have hay fever or allergic skin problems. Now, for the lung damp cold type, asthma is constant, only better or worse periodically. On listening to the chest with a stethoscope, wheezy breath sounds and adventitious sounds such as crepitations are almost always present. Asthma may be worse in wet, cold weather and at nights or early mornings. Attacks with much wet cough and foamy mucus. Thick, moist skin, hairy. Melancholic, happy in their sweet, sad state with no changes. They can suffer from black nose and yin type of neurodermatitis. Okay, so for the treatment, for the lung wind heat type, we use lung 1, lung 7, spleen 10, Ren 17, tonification, and Do 20, Ren 22. Then SI8 sedation, GB38 sedation. Liver 5, the Luo point against the bronchospasm. For the lung damp cold type treatment, lung 10, LI11, stomach 40, LI6, Ren 17, sedation. Bladder 13 and 17, moxa and cupping. Bladder 17 is used only as an additional local point posterior to the lung, considering its largeness. This point has no special significance in this case. Then we do acupuncture on the bakshu point. So we have the corresponding points that we shall needle for the first day, the second day, and the third day. Point 0.5 to 1 ml vitamin B12 IM intramuscular injections given daily from Monday to Friday. 2 bakshu points daily as marked in the diagram, starting from T1 and ending at T10. After 5 days, there should be a week's break. Then another 5-day treatment can be given, commencing on the Monday of the 3rd week. 2 courses will complete the treatment. This is the general concept of the treatment. In the wind heat type, it is important to tonify the general yin if there are many organs that are dry. In this case, one could use the Ren meridian, the lung 7 confluent point, and 3 points on the meridian Ren 3, 14, and 17. If there are scars obstructing the lung or Ren meridian, they ought to be unblocked. In the damp cold type, it is necessary to balance the spleen, as the dampness originates internally from the spleen. Points bladder 20 and spleen 1 can be used for this, and the patient should be advised to avoid milk products and cold raw foods. The treatments have to be given twice weekly for 4 to 6 weeks, then once weekly for 4 weeks, and then finally reduced to once fortnightly for 3 months. If acupuncture is used, other points on the skin could still be given simultaneously. Acupuncture is used daily, but the other points are not given more than twice in a week. The wind heat type of patient responds quickly and extremely well. They should be encouraged to stop regular inhalers as soon as possible, but carry them on their person. Using medication without actually needing it creates dependency, pushing the patient into the group of constant in type. The in type patient responds at a slower pace to the therapy. The acupuncture may even worsen the symptoms initially, but it makes a great difference to the results in the long term. It is very effective in chronic asthmatic bronchitis and emphysema. So if you find that a patient does not fit exactly into the yin type described in the table, then you may wish to refer to the other table. Thank you very much for your attention. Now let's go to topic number 5, Theory of Zangfu Organs, Part 2. The theory of the internal organs is often described as the core of Chinese medical theory because it best represents the Chinese medicine view of the body as an integrated whole. This theory represents a landscape of functional relationships, which provide total integration of bodily functions, emotions, mental activities, tissues, sense organs, and environmental influences. When studying the Chinese theory of the internal organs, it is best to rid oneself of the Western concept of internal organs entirely. Chinese medicine sees each organ as a complex system, encompassing its anatomical entity and its corresponding emotion, tissue, sense organ, mental faculty, color, climate, and more. One of the main functions of the internal organs is to ensure the production, maintenance, replenishment, transformation, and movement of the vital substances. Each of the vital substances, qi, blood, essence, and body fluids, is related to one or more of the organs. The heart governs blood, the liver stores blood, the lungs govern qi and influence body fluids, the spleen governs food qi, holds blood, and influences body fluids. The kidneys store essence and influence body fluids. Each organ influences one of the tissues of the body. There is a functional relationship between certain tissues and each organ so that the state of the organ can be deduced by observation of the tissue related to it. Thus, the heart controls the blood vessels and manifests in the complexion. The liver controls the sinews and manifests in the nails. The lungs control the skin and manifest in the body hair. The spleen controls the muscles and manifests in the lips. The kidneys control the bones and manifest in the hair. Each organ is functionally related to one of the sense organs. This means that the health and acuity of a particular sense organ relies on the nourishment of an internal organ. Thus, the heart controls tongue and taste, the liver controls eyes and sight, lungs control nose and smell, spleen controls mouth and taste, kidneys control ears and hearing. The same qi that is the basis for all the physiological processes is also the basis for emotional and mental processes, since qi exists in many different states of refinement. Whereas in Western physiology, emotional and mental processes are attributed to the brain, in Chinese medicine, they are part of the sphere of action of the internal organs. The relation between each organ and a particular emotion is mutual. The state of the organ will affect the emotions, and emotions will affect the state of the organ. Thus, heart relates to joy, liver to anger, lungs to sadness and worry, spleen to thinking, kidneys to fear. These emotions usually only become a cause of imbalance when they are excessive and prolonged. By treating a specific organ, we can influence the particular emotion related to that organ and help a person to achieve a more balanced emotional state. We next proceed to the water element, musculoskeletal pain. So we have here a clinical example, energy treatment of musculoskeletal pain. A 45-year-old man comes in with an acute backache and sciatic pain. This pain started suddenly on lifting a heavy box off the floor a few days ago. The pain is mainly on the low back left buttock and radiates down the back of the thigh to the ankle. He cannot stand or walk with pain, but is comfortable when lying in a curled position. When standing, he leans forward and away from the side of the pain in order to relieve it. The patient was treated daily and the pain reduced each time after treatment. On the pain scale between 0 and 10, he indicated 10 at the start of the first session and 2 at the end of it. Some pain returned, and at the beginning of the second session, he gave it a score of 6 and 2 after the treatment. On the third day, he walked well, could stand straight, and had needed no pain medication. He gave the pain a score of 4 at the start and 1/2 at the end of the third session. The treatment was then given twice in a week. After 5 sessions in all, he was completely free of pain. Diagnosis is urinary bladder meridian hot pain. The patient suffers from an acute yang dominant pain on the urinary bladder meridian. There is a yang excess situation in the meridian which should be sedated. Treatment: 4 local points, bladder 24, 27, 54, gallbladder 30 with electrical stimulation using 5 to 10 hertz, continuous frequency, 20 minutes. Urinary bladder 63 sedation, the she cleft point, SI7 sedation at the end when local needles have been removed. So this is the 1-point therapy. Bladder 40, distal point for the back. For ear acupuncture, we used sciatic nerve, kidney, and Shenman. In this case, the patient was given 4 local needles, but all of them were continuously agitated through electrical stimulation. This amounts to steadily vibrating the needles for 20 minutes, similar to the hand technique of needle sedation. All other needles used were distal points to the affected area, especially point SI7, which was the most distal point, as it was on the arm meridian of the same polarity as urinary bladder. Also, 2 distal and 4 local points were all sedated to disperse the excess energy away in this excess situation. Now let's go to clinical example 2, energy treatment of musculoskeletal pain. A woman aged 52 came in with a chronic backache for 8 years. She was not able to do housework for more than half an hour as her low backache would rapidly increase to the point when the pain went down both her legs, making them feel weak. The pain would disappear within 10 minutes if she sat down, and then she could stand up once more to continue her work. She took a folding stool with her when she went out. She had been quite slim in the past, but now she was gaining weight because of the lack of exercise. She had been treated with painkillers, antidepressants, and had 2 epidural injections at the hospital, but the pain was gradually worsening. The last 2 years had been particularly bad. Diagnosis: chronic hot pain on the urinary bladder meridian, urinary bladder, and kidney. The patient had a yang dominant pain as it was worse on standing and walking, so the yang, and improved when sitting and resting, yin. But it was a chronic backache with an 8-year history and seemed to have worsened in the postmenopausal period. The treatment, therefore, was to treat the hot pain locally and to tonify the yin of the urinary bladder meridian and to tonify her kidney yin, which seemed to be deficient during the menopause. 4 local needles, 2 on either side of the low back with electrical stimulation, bladder 40, distal point, and earth point, grandmother point, which tonifies the yin. Kidney 7, tonification point, tonifies mostly the yin in the kidneys and indirectly also in the urinary bladder. Ren 3, the front mu point of the urinary bladder, can be used to tonify the yin. Patient was advised to do some light abdominal exercises on the bed, to bend each knee and bring it up towards her chest a few times. She was also asked to drink more water and to reduce the medication with the reduction of pain. She was treated twice a week until some improvement was noticed, and then once weekly. There was no significant change in the pain for about 2 weeks. That's a total of 4 treatments, and then she felt better and stronger in the back and legs. Each time, the pain medication was gradually reduced. She had some worsening of the pain, but adapted well. After the once-weekly treatment for 10 weeks, she was treated fortnightly for a month before the treatment was ended. She continues doing the abdominal exercises and takes short walks regularly and care not to exert herself too much. Let's now proceed to the meridian theory. Okay, so we continue with our discussion of the yang motility meridian and the yin motility meridian. So we have here an example, a 33-year-old male. The patient presented with chronic recurrent headaches in the forehead and over the sinuses. The head felt heavy and the headaches worsened after sleep. They were worse in the mornings on waking and improved in the evenings. He was always sleepy and would fall asleep anytime at any place. His sleep was very deep and he did not feel awake and lively in the day. This was clearly a yin-dominant headache with yang deficiency due to the chronic history. It might have been related to the sinuses and became worse when the patient was lying down and improved when the patient was upright as the mucus could drain away. Treatment, local points, bladder 2, gallbladder 14, and Li 20 were used along with Li 4. Gallbladder 20 for headache and stomach 40 for the damp nature of the headache. Point kidney 6 was used as a general excitation point against the sleepiness and dullness. Headache cleared within 3 sessions of treatment. The patient felt awake and lively. Another example is a 56-year-old male. This patient suffered from daily headaches. They were at both temples and came on when hungry, thirsty, or stressed. He was quite a tense, restless man with a quick temper. He had very dry skin, red flushed cheeks, and was on medication for his high blood pressure. He had burning pain in the stomach when hungry and excessive thirst. His stools were hard and dry and his urine dark and concentrated. His sleep was full of disturbing dreams. On examination, his tongue was quite red without coating, and there was a deep and uneven crack at the center line of the entire tongue. As he was taking beta blockers, his pulses could not be used to ascertain his actual energy status. He was generally yin deficient and had yang excess, hyperactivity of the yang, and did best on Ren 15, luo connecting point of Ren meridian. So this tonifies the yin and sedates the yang. Urinary bladder 62, the confluent point of yang motility meridian, which sedates yang and tonifies yin. Besides this, he was advised to take more in foods. His sleep problem was treated. Local and symptomatic points were used to treat the headache. He felt the change in his energy state immediately after the first session. He mentioned he was cooler and more relaxed. He drank more water and rested in the afternoons. When there is a hyperactive yang state in the body, both Ren meridian tonification and yang motility can be used. When there is a stagnation or yin retention in the body, both do meridian tonification and yin motility meridian can be used. Now let's go to the final topic for this afternoon, chronic fatigue syndrome. We will continue with the discussion of the summary. Now let's talk about the in-fire. The concept of in-fire was introduced by Li Tongyuan, in his book, Pi Wei Lun, Discussion of Stomach and Spleen, circa 1249. Dr. Li says that, as a result of improper diet and overwork, the original qi or yuan qi becomes weak in the lower burner, and the stomach and spleen are weakened in the middle burner. This causes the patient to feel tired and often cold. When the patient is also subject to emotional stress, the minister fire is stirred, it becomes pathological, and it leaves its place of concealment in the lower dantian. Dr. Li said that the pathological minister fire becomes a thief of the original qi. The arousal of the pathological minister fire upwards causes some heat symptoms in the upper part of the body, such as a red face and mouth ulcers. This is called in-fire. In-fire is neither full heat nor empty heat, but simply a different kind of heat that derives from deficiency of the original qi and the stomach and spleen. In-fire is not treated by clearing heat or draining fire, but by tonifying the original qi and gently clearing the heat upwards. The middle burner has dampness, spleen qi or even spleen yang is deficient and fails to rise. The main clinical manifestations of yin fire are feeling of heat in the face, red face, mouth ulcers, occasionally a low-grade fever, dizziness, weak voice, depression, muscle weakness, exhaustion, feeling cold in general, loose stools, cold feet, spontaneous sweating, shortness of breath, pale tongue, weak pulse. In chronic fatigue syndrome, there is always an underlying deficiency of the body's qi, which favors the formation of latent heat, a residual pathogenic factor, or of yin fire. The deficiency may be of qi, yang, bladder, yin. The organs involved are mainly the spleen, lungs, liver, and kidneys. In the development of latent heat and in-fire, a deficiency of the kidneys is particularly important. Thank you very much for joining, and we hope you can join us again in our next presentation. Thank you.